Welcome back. We're so glad to have you back with us. Hope you still have your pens and paper ready to take a lot of information. I've got an expert here on prostate cancer and a lot of things about prostate cancer, and Jim Gregory is going to help us by answering some questions and providing you a lot of information as well as a contact information. So if you have any additional questions later on that he hasn't answered, you can always call him and get the answers. So I want to thank you, Jim, for coming to the program.
My pleasure, Tom.
All right. We've got a lot of, we don't have a whole lot of time, and we've got a lot of information. So let's jump right into this. Prostate cancer, what's it all about?
According to the World Health Organization, prostate cancer is the most common cancer in men worldwide.
Worldwide.
In 2012, 1.1 million men were diagnosed worldwide, with 300,000 dying from the disease. Now that's 3 in 11.
That's pretty tough, Jim.
It is tough. Now, the numbers I remember is 1 in 5 person in the United States, Caucasian in particular, 1 in 5 will be diagnosed with prostate cancer sometime during their lifetime, and normally they don't start checking until about the age 40. However, I know a young fellow back east where I was raised in his mid-30s, and he died from prostate cancer, a very aggressive prostate cancer. I think about 3 months he was gone, and that's in his 30s. So my personal recommendation is get your base PSA done around mid-30s.
What's a PSA, Jim?
That's a specific, prostate-specific antigen. It's a marker, blood marker, which is one of the tools that they've used for years to indicate if you have cancer or not. Usually if you get a PSA, and the range, normal range is 4 and below. Anything over 4, they'll watch it. If it gets up to 10, 12, 14, somewhere in there, they'll probably send you in for a biopsy and to a urologist. And keep in mind, these urologists, a lot of these doctors who treat cancer have an invested interest in what treatment they talk you into. So be very careful.
But Jim, if you're looking at a PSA, at what age would you recommend men get a PSA blood test?
I just said 35.
At age 35 and above.
Yep.
And anybody listening that know any men that are 35 and above that have not had a PSA blood test, Jim is saying, get out there and get one. And that established the baseline, right?
Yes, I would recommend get your baseline in the mid-30s. They recommend at 40. You may not be able to talk your doctor into doing it. Depends on his attitude. And the VA is, you know, they've turned thumbs down on doing a lot of PSA tests. For what reason, I don't know. It's basically, until recently, been the only real tool we have for a red light showing that you may possibly have prostate cancer.
I like the fact that you said if it's 4 or below, that's pretty normal. Mm-hmm. And once you establish that baseline, if it goes up to, say, 6, 8, 10, or higher, you've got some problems.
Yeah, I would get your baseline, and then depending on your age, I would go 2, 3, 4 years, get it again, see if anything has happened. And then when you get up to 40, 45, I would get it once every year, maybe once every 2 years.
Okay.
Just to keep up with what's going on, so you know what's in your prostate, and within reason.
And when should you be concerned about this thing you talked about, Gleason score?
Let me say something out before I get to a little bit on my background. I was diagnosed in 1994 I
Okay.
moved here from back east. 3 months later, I was diagnosed with cancer. Didn't know anybody, didn't know any doctors. There was really no doctors out here in Pahrump. So I'm a lost soul. Anyway, my PSA was 54
Wow.
when 4 is the normal upper limit. My Gleason came back a 7. Now that's Gleason is a score of the reading of the biopsy on a scale of 1 to 10, and we've got the chart up here, and you can see on the left, this is the grades of prostate cancer, or a Gleason score rather. Your lower scores are more random, or they're larger size, or spread out, and then you see, if you go to the right there from the left page, you'll see grades 3, 4, and 5, and as you go up in grade, the texture changes a lot. It goes from large prostate globules down to small, refined, and a lot more numerous. Over on the right page, you get a picture of basically the same thing. You get the first one is grade 3, then it go over to grade 4. You can see a big difference there, and then you go over to grade 5. There's a great big difference there. And as you go up to scale there, and remember, it's a grade from, they get the grade from the 2 worst biopsy samples. They add the 2 together, and these are the scores that they use there. So the higher your Gleason score, the more aggressive your disease should be.
So if you have a Gleason score of 5, you've got some problems.
Not necessarily, Tom. Gleason 6 is where the center dividing line is.
Okay.
If your Gleason is above 6, they're going to go after you. If it's below 6, they'll probably say, well, you can watch it for a while. There is, let me back up a little bit here. The urologist, the one that cut on you, burn you, or radiate you there, or freeze you, depending on what their profession is, they're going to push you towards that. If you do get diagnosed, be sure to get a second or a third opinion if you have good insurance.
Okay.
The key to surviving prostate cancer, especially if it's aggressive, is number 1, good insurance. Number 2, get the best doctors in the country. I used to drive all the way to LA to see a doctor because I couldn't find anybody out here I trusted. And I'm talking about Las Vegas. I do have one of the greatest cancer doctors in the world right now. Can I mention his name?
Sure.
Dr. Vogelsang. He's
Yes.
with the cancer center over on Eastern there. This guy is world-renowned. He spends probably a third of his life in the air traveling around the world.
And he's even come over to Pahrump to talk to us, hasn't he?
He's been over and give
Okay.
us 3 or 4 presentations at the local casino. He would come out again, but he's just got so busy. He's working
Oh, gee.
15 hours a day, 6 days a week now. He's working himself to death. I feel sorry for the guy. But the Gleason score, the PSA, the first thing I'm going to have you do is give you a blood test, PSA. And if it looks daunting, then they'll send you in for a biopsy. Now, the latest thing that's getting doctors' attention is watchful waiting. Prostate cancer is a very slow-growing disease, so every patient who is diagnosed with prostate cancer, first thing you're told you got cancer. You go into shock. You can't believe it. And then you start to realize, yeah, you got into shock. You've got cancer. Well, the first thing you want to do is to get it out of your body, the fastest and easiest way they know how to do.
Nobody wants to have cancer inside.
No, they don't, and getting rid of it don't necessarily solve the problem.
Right.
They got rid of my prostate to start with. 30 months later, the PSA came back rising. I went to see my urologist, and I said, "What are we going to do, doctor?" He said, "Well, with people like you, it comes back on after you've had surgery." He says, "We don't really know what to do." So I said, "Well, I know what to do, doctor." I said, "I want to go on triple hormone blockade." That is a safe way to go until you make your decisions. You go on hormone blocking drugs for a few years if they feel necessary.
Well, Jim, I know we're going to run out of time, but if somebody has some questions, I know they can get your number, and we're going to have your numbers on the screen.
Yep.
But how about a meeting? Is there a prostate cancer support group?
Yes, Tom and I are together hold the prostate cancer group. It's the Us Two International. We're a umbrella of international. We hold our meetings on the fourth Thursday of each month, 10 months a year. We don't meet on Thanksgiving nor Christmas. So our next meeting will be the fourth Thursday in January. We meet at the local hospital down in the basement conference room. You have to go through the emergency room. Now they shut the place down at 6 o'clock, so go through the emergency room. Tell me you need to go down to the meeting, and they'll give you directions. We have a small group, but it's a real good group of men. We are getting ladies show up lately, and we're trying to encourage them more. And it looks like we're going to run out of time, and I'm about halfway through.
Well, one of the things we can do, Jim, is make sure that you come back on the next show.
Yeah, we'll cover the 4K score test, which is a new blood test, which the manufacturer, the drug company, is claiming is more accurate in predicting aggressive cancer than
I'm gonna have to say that anybody that's interested in anything that Jim is saying, please call him, ask him questions. He's got a wealth of knowledge, and we are definitely out of time. So I'm gonna have to say, Jim, I'm gonna invite you back for the next meeting, and I want you to come back at that same time.
Yeah, I'm home.
We'll see you next month.
I'm home most times, so give me a call anytime, folks.
Thank you, Jim.
Okay.